Bismillah ar-Rahman ar-Rahim. And your Lord had said, "Pray unto me, and I will hear your prayer." This is from Quran. I am Dr. Taimia Ayub. I am FCPS trainee, and I will be presenting today the topic of trachoma under the kind supervision of Professor Dr. Saira Afzal, Dean Institute of Public Health, Lahore. These are the learning outline for today's lecture. We will start with introduction, then we will cover epidemiological determinants, clinical progression, complication management, then we will apply levels of prevention at trachoma, and then we will cover burden of disease, recent advances, and at the end, multiple choice questions. This is the learning outcome from for today's presentation. So, what is trachoma? It is a disease caused by infection with Chlamydia trachomatis. It is transmitted from one person to another. Multiple infections leads to visual impairment and blindness from trachoma is irreversible. Trachoma is the leading infectious cause of blindness worldwide. It is responsible for the blindness or visual impairment for about 1.9 million people. It causes about 1.4% of all blindness worldwide. Blindness from trachoma, as I mentioned earlier, is irreversible. It is a public health problem in 38 countries. Based on the data of last year, 103 million people live in trachoma endemic areas and are at risk of trachoma blindness. Trachoma is hyperendemic in many poorest and most rural areas of Africa, Central and South America, Asia, Australia, and Middle East. Overall, Africa remains the most effective continent and the one with the most intensive control efforts. This is the epidemiological triad of the trachoma. As you can see, we will start with the agent, and then we have the environment, and then we will have the host. So we will apply these try to cover the three aspects of epidemiological triad for the disease of trachoma also. So the agent factors include, as I mentioned earlier, it is caused by Chlamydia trachomatis. It has immune types A, B, or C. It is obligatory intracellular bacteria. Reservoir is children with active disease, chronically infected older children and adults. Source of infection are the ocular discharges of infected persons and fomites. Communicability, has low infectivity. It is infective as long as active lesions are present in the conjunctiva, but not after complete cicatrization. Host factors include age. Children from age 2 to 5 years are the most infected. Sex, it is prevalent in younger age population. In older age group, females have been found to be more affected than male. Predisposing factors, direct sunlight, dust, smoke, and irritants such as kajal or surma may predispose to infection. Environmental factors include season and quality of life. Season has high temperature and rainfall favors the increase in fly population. April, May, and again during July and September. Quality of life, the disease thrives in condition of poor housing, inadequate hygiene, crowded households, inadequate access to water, and inadequate access to sanitation. Mode of transmission, in communities where trachoma is endemic, eye to eye transmission can be considered as a rule. This may occur by direct or indirect contact with ocular discharges of infected persons or fomite. For example, infected fingers, towels, kajal, or surma. Icy thinking flies, for example, Musca species, play some role in spreading the infection by mechanical transmission. Incubation period is from 5 to 12 days. In countries where only sporadic cases of trachoma occurs, genital localization of chlamydia trachomatis, urethral or cervical may lead to venereal transmission. It has been shown that trachoma is a familial disease. When one case is detected, others will most certainly be found in family group. This is the routes of transmission of chlamydia trachomatis and potential pathways. As you can see, we will start with the left side. Person with ocular chlamydia trachomatis infection. It can spread through flies. Flies can spread it to animals, waste disposal, sanitation issues, and then we can have fomites like bed sheets, cloths, towels, etc. And then we have fingers, when you are when the infected person is washing the face. Then flies can be affected, can spread by flies, fomites, these and fingers. They can spread to infection to uninfected person also. Age of onset, it is in very high endemic communities. It can occur in childhood, though onset of visual impairment between the ages of 30 and 40 years is more typical. Women are blinded up to 4 times more often as men, probably due to their close contact with infected children and their resulting greater frequency of infection episode. So, clinical progression, an individual's immune system can clear a single episode of infection, but in endemic communities, reacquisition of the organism occur frequently. After years of repeated infections, the inside of the eyelid can become so severely scarred, trichomatous conjunctival scarring, that it turns inwards and causes the eyelashes to rub against the eyeball, trichomatous trichiasis, resulting in constant pain and light intolerance. This and other alteration of the eyes can lead to scarring of the cornea. Left untreated, this condition leads to the formation of irreversible opacities, resulting in visual impairment or blindness. WHO has identified 5 stages in the development of trachoma. Inflammation, follicular stage. The early infection has 5 or more follicle small bumps that contains lymphocyte visible on the inner surface of your upper eyelid conjunctiva. Then we have inflammation, which can be intense. Eye is now highly infectious and becomes irritated with a thickening or swelling of the upper eyelid. Eyelid scarring. Repeated infections leads to scarring of the inner eyelid. The scar often appears as white lines. Eyelid may become distorted. The eyelid often appears as white lines. Your eyelid may become distorted and may turn in entropion. In turned eyelashes, trichiasis, the scarring inner lining of your eyelid continue to transparent outer surface of your eye like cornea. And then finally, we have corneal clouding or opacity. The cornea becomes affected by an inflammation that is most commonly seen under your upper eyelid. Continuous inflammation compounded by scratching from the in turned lashes lead to clouding of the cornea. Stages in the development of trachoma, as I have mentioned earlier, this is now shown in the form of pictures. You can see it starts with normal eye on the left side, then we have inflammation in the follicular in the upper right side, then we have intense inflammation followed by eyelid scarring or entropion, then we have interned eyelashes, trichiasis, and then we have finally corneal clouding or opacity. Symptoms. Signs and symptoms of trachoma usually affects both eyes and may include mild itching and irritation of the eyes and eyelid, eye discharge containing mucus or pus, eyelid swelling, light sensitivity, eye pain, eye redness, vision loss. So this is the cycle of trachoma. It starts with the poverty, and then we have which is increased by crowding, decreased water, decreased availability of washrooms or latrines. Then we have crowding, which leads to sleep issues, family knowledge, attitude practices, and increase amount of lies, which all leads to lack of facial cleanliness, infections and reinfections, trichomatous inflammation, follicular and intense, and then we have trichomatous conjunctival scarring, trichiasis, and corneal opacity, finally, which all leads to blindness. For the management, we can have for the management, either we have options of antibiotics or surgery. For antibiotics, we have azithromycin, single oral dose of 20 milligram per kg, or tetracycline, topical 1% eye ointment twice a day for 6 weeks. Azithromycin is preferred more and more effective because it is used as a single oral dose. In cases of complication, we have options of surgery. For individuals with trichiasis, a bilamellar tarsal rotation procedure is warranted to direct the lashes away from the globe. Corneal transplantation for corneal clouding. Early intervention is beneficial as the rate of recurrence is higher in more advanced disease. For elimination of trachoma as a public health problem is defined as a prevalence of trachomatous trichiasis unknown to health system of less than 0.2% in adults age greater than or equal to 15 years of age, approximately one case per thousand total population. Prevalence of trachomatous inflammation follicular in children age 1 to 9 years of age, less than 5% sustained for at least 2 years in the absence of ongoing antibiotic mass treatment in each formerly endemic district, or plus the existence of a system able to identify and manage incident trachomatous trichiasis cases using defined strategies with evidence of appropriate financial resources to implement those strategies. So now we will try to implement the levels of prevention on trachoma. We have similarly we have primary prevention, secondary prevention, and tertiary prevention. At primary prevention, it is preventing the onset of disease. The goal is to stop transmission and reduce new infections. Key interventions include improved facial cleanliness in children through hygiene promotion, F of safe environmental improvement, access to clean water, improved sanitation, reducing fly breeding site, E of safe, health education for families and schools on hand washing, washing of children's faces and avoiding shared towels, community-wide mass drug administration with azithromycin in endemic areas, A of safe, improve living condition, reduce crowding, better work waste disposal. Then we have secondary prevention, which aim of early detection and prompt treatment. Goal is to identify and treat active trachoma early to prevent complications. Key interventions: screening of children under 10 years in endemic communities for active trachoma, early antibiotic treatment for confirmed cases, regular school-based screening program for trachomatous inflammation follicular and trachomatous inflammation intense, monitoring household contacts of infected children. Then finally, we have tertiary prevention, reducing complications and disability. Goal is to prevent blindness and long-term disability. Key interventions can include surgical corrections of trichiasis as of safe to prevent corneal damage and vision loss. Then we have rehabilitation and referral for advanced cases with low vision or blindness. Follow-up care after surgery to prevent reoccurrence. And finally, provision of assistive devices and community-based rehabilitation for effective individual. Uh, Again, prevention strategies can include environmental measures like modifications in water use, fly control, latrine use, health education, and proximity to domesticated animals have all been proposed to reduce transmission. Use of insecticide spray resulted in significant reductions of trachoma and fly density. Health education also resulted in reduction. Then we have antibiotics. WHO guidelines recommend that a region should receive community-based mass antibiotic treatment when the prevalence of active trachoma among 1 to 9 years old children is greater than 10%. Subsequent annual treatment should be administered for 3 years. Annual treatment should continue until the prevalence drops below 5%. At lower prevalences, antibiotic treatment should be family-based. WHO adopted the SAFE strategy in 1993. WHO mandate is to provide leadership and coordination to international efforts aiming to eliminate trachoma as public health system and to report on progress towards that target. In WHO, 1996, WHO laws launched the WHO Alliance for Global Elimination of Trachoma by 2020. The Alliance of the alliance is a partnership which supports implementation of safe strategy by member states and the strengthening of national capacity through epidemiological surveys, monitoring, surveillance, project evaluation, and resource mobilization. This is the elimination strategy. The safe strategy is recommended by WHO. S is for surgery for advanced disease. A is for antibiotics to clear chlamydia trachomatis infection. F is for facial cleanliness. And E is for environmental improvement to reduce transmission. So surgery, antibiotics, facial cleanliness, and environmental improvement. It makes the acronym SAFE. So now we come to the burden of disease. This trachoma is defeating the world's leading infectious diseases or blindness that's mandated by World Health Organization. Target is to elimination as public health problem. Progress is that the number of people at risk fell from 1.5 billion in 2002 to 137 million in 2020, about 91% reduction and 74% reduction in number of people with advanced disease, and 10 countries validated by WHO for achieving elimination. That was in 2020. Burden public health problem in 44 countries, estimated 137 million at risk in endemic areas, has visually impaired impaired or blinded 1.3 million people. Africa is the most affected continent. Women are 4 times more likely and need for advanced disease as compared to men. Economic impact, the economic cost in terms of lost productivity from blindness and visual impairment is estimated at about US 2.9 to 5.3 billion and dollars annually, increasing to $8 billion when tri cases included. In 2023, 130,000 nearly people received surgical treatment for advanced stage of the disease, and 32.9 million people were treated with antibiotics. Global antibiotic coverage in 2023 was 29%. So this is uh, the diagrammatic representation between 1996 and 2021. It is a service. It is showing the decline of trachoma in Africa after large efforts to provide antibiotic, clean water, and improve hygiene. As you can see from the left side, this is the situation which was present in 1996, and it is showing share of children with follicular trachoma. So the darkest maroon color is showing the uh, greater than 50% of the children were with follicular trachoma, and a fair amount is shown between 5 to 10% having trachoma. And fast forward to 2021, we can see that much of the darker colors have decreased, and the prominent color is the lightest shade of purple, which means that less than 5% of the children are having follicular trachoma. So, trachoma elimination goal as of December 2024, the World Health Organization has validated 21 countries as having eliminated trachoma as public health problem. Benin was the first, followed by Cambodia, China, and we also have India, Islamic Republic of Iran, Iraq, and at the 17th number we have Pakistan also. So these are showing the countries where trachoma is a public health problem in 2024, and it is showing the progress towards elimination of trachoma as a public health issue. And in so you can see that the orange are showing the countries where the trachoma disease is a confirmed public health problem. So we have much of the Africa and even South America, with Brazil as the biggest country, and even Australia has trachoma as public health problem. Then we have the countries, light green countries are showing the where the trachoma is a non-endemic country. It is showing in Russia, and then we have United States of America and Canada where it is non-endemic. And then the blue shade is showing those countries which have been certified that these have eliminated trachoma as public health problem. So we have much of the South Asia, Pakistan, India, Bangladesh, not Bangladesh, but China, Iran, Saudi Arabia. So we have these countries which have eliminated trachoma as public health problem. And then we have news. Pakistan is the 19th country worldwide to eliminate trachoma. Pakistan is the latest country to eliminate the eye disease trachoma as a public health problem, with supports from site savers, and other partners. Elimination of trachoma in Pakistan, a public health milestone. Pakistan eliminated trachoma as a public health problem in October 2024. It was the 19th country globally. Key initiative which helped it was National Trachoma Task Force implemented the SAFE strategy. Pakistan Trachoma Elimination Project focused on safe strategy in underserved regions uh, with help from WaterAid. Integrated people-centered eye care, strengthened eye care integration in health system, Impact validated by WHO for eliminating trachoma, inspiration for tackling neglected tropical diseases globally, and it is a testament to Pakistan's commitment to public health. So, the recent advances, we have a new surgical technique for post-operative trachomatis tracheasis. The World Health Organization has identified management of post-operative trichiasis as one of the key remaining areas of focus needed to eliminate blinding trachoma as public health problem. We developed the bevel rotation advancement procedure BRAP to treat individuals who need repeat trichiasis surgery. So, what happened was that at the end, BRAP was developed considering the altered eyelid anatomy found in post-surgical eyelid with trichiasis, trachomatis trichiasis. Thinning of the eyelash fragment and removal of post-operative scar tissue improves the ability to advance and stabilize the eyelash fragment after external rotation. And BRAP shows promise as a procedure for improving outcome for repeat trichiasis surgery. Again, this is another paper which is showing medicinal plant and phytochemicals effective against Chlamydia trachomatis, the causative agent of trachoma. So, conventional antibiotics are used for trachoma's treatment. However, the pathogenic bacterium complicated life cycle is a challenge to the treatment from their reduced sensitivities to conventional drug. Thus, options are sorted in phytochemicals effective against trachoma as a treatment strategy. Literature has identified the following phytochemicals: bacillin, berberine, catechins, coumarins, and cumin, among others, as active compounds from plant to treat trachoma. So now we come to the multiple choice questions of the the first MCQ is: trachoma is a public health problem in 44 countries. Which one of the following is true about prevalence of active trachoma? The prevalence of active trachoma increases with age. Although the prevalence rates of active trachoma are similar in males and females, the later sequelae, trichiasis, and tropion corneal opacification are more common in women than men. The global prevalence of active trachoma is 10 million cases. Second leading cause of infectious blindness, first being the onchocerciasis, and active trachoma predominantly affects individual over 50 years of age.
D.
Um,
B.
Sorry, I think it is B. I will confirm it at the end because I think that it is more common in women, as we have said it multiple times, the complication. But I will check it at the end. Okay. So, which of the following patients with trachoma, as defined by World Health Organization simplified grading system, are at highest risk of blindness? Patients with trachomatis inflammation, follicular; patients with trachomatis inflammation intense; patients with trachomatis scarring; or patients with trachomatis trichiasis; or E, patients with active trachoma but no visible corneal damage.
C.
C.
So, according to the key, it is the patients with trachomatis trichiasis. These are at the highest rate of blindness because the eyelid is going to irritate the cornea, which leads to uh, the opacity of the cornea. Trachoma is disease of eye that may cause visual impairment and blindness if left untreated. Which of the following population is at lowest risk of attracting the disease? The population living in conditions of poor and overcrowded housing, inadequate hygiene, inadequate access to water and sanitation. In regions of high temperature and rainfall, adult females have four times less chance of developing um, visual impairment and blindness. In regions of with lowest density of flies, or E, in children under 15 living in fly infested region.
C.
Uh, Basically, it is answer D. It is the regions with the lowest density of flies. which leads to the people living there will have the lowest chances. A 4-year-old child belongs to a well groomed family, recently comes from Ethiopia, presented to their family physician with complaints of red eye with discharges from eye irritation and photophobia. He never experienced this before. The doctor suspects him as a case of trachoma. His parents were worried about his vision loss. How the doctor should can counsel them. The disease once occurred lead to permanent vision loss. Surgery is the only option to prevent blindness. A series of repeated infections may lead to blindness. There is no use of good hygiene measures to prevent reinfection and visual loss. Antibiotic treatment has no role in managing the infection. So the answer is Charlie.
C.
Yes, see, the answer is Charlie because only one time infection can have less chances of causing blindness. It is the series of repeated infection, if not treated, which leads to the blindness. Which of the following is true about WHO's safe strategy to reduce transmission of chlamydia trachomatis? Single oral dose of azithromycin is more effective for managing trachoma than topical tetracycline. All four components of the strategy have been proven effective in multiple RCTs. With this strategy, the WHO is aiming to eliminate trachoma by the year 2040. Surgery is the most effective and safest method for preventing trachoma. The WHO safe strategy focuses solely on antibiotic treatment to reduce transmission of chlamydia trachomatis.
E.
Uh, it's A.
C.
in in the antibiotic, the single oral dose of azithromycin is more effective for managing trachoma than topical tetracycline. This is You have been appointed as a district health officer of District Dera Ghazi Khan and noticed a huge number of patients infected with trachoma. Which public health measure you will adopt in the district to prevent a spread of trachoma? Mass drug administration of single oral dose of azithromycin when the prevalence of active trachoma among 1 to 9 years old is greater than 5%. Subsequent annual mass antibiotic treatment should be administered for at least 5 years. Annual antibiotic treatment should continue until the prevalence drop below 5%. Only health education regarding frequent washing and insecticide spray are sufficient. Mass drug administration should be discontinued after one dose, regardless of prevalence.
A.
So, what to do in this case? That
A.
our target should be uh, do annual antibiotic treatment should continue with until the prevalence drops below 5%. So it is Charlie. All the population should be focused instead of only children because it can spread from anybody. A 32-year-old male, a 32-year-old beggar presented in IOPD with red and swollen eye. On examination, his eyelashes have moved inward during the towards the eyeball and touching the cornea with visual acuity of 5 by 6 in both eyes. Which treatment option is best for him to prevent visual impairment? Practice facial cleanliness and avoid touching his eyes with fingers. A combination of oral and topical antibiotics. Surgery to remove the eyelash, touching the cornea. Frequent cold water sprinkling in the eye. Prescribe lubricating eye drops and monitor for further complications.
C.
Yes.
C.
Yes, C should be done. You are working as a airport medical officer in Jeddah, Saudi Arabia. One Hajj pilgrim with family from Sudan seeks your medical assistance for ongoing trachoma infection. What will you advise for the prevention and management of trachoma? Avoid too much physical activity. Avoid using others' towels and clothes. Remain quarantined for 1 month. Prescribe antibiotic to him alone. Advise mass antibiotic treatment for the entire family and maintain good hygiene practice.
E.
Yes.
E.
Yes, E should be done. The literature review suggests that adult females develop 4 times more trachoma-induced blindness as compared to males due to which reason? More uses of eye makeup, close contact with children, venereal diseases also affect eye, decreased immunity in females, poor access to healthcare services.
B.
Yes, it's close contact with children. That's why. The picture shown in the figure is of 35 years old man who is suffering from trachoma. He is at which stage of disease? Inflamed conjunctiva, entropion, trichiasis, corneal clouding, or citricial trachoma.
E.
C.
It is C. So basically, the picture is not clear. So according to the key, it's C. Sorry about that. This is the YouTube link on which the presentation will be uploaded. And thank you very much for watching.
Thank you,
Okay.
Taimia. It is a very informative and good presentation. The